All right, back for round two. I got Dr. Sharma here again on COVID-19, and this time it actually had to be pre-recorded because, as we did it live last time, it unfortunately made my video quality go right down the tubes. But I've got a ton of questions from other people. I made a few posts on Twitter and Facebook, and I had a ton of feedback. People were sending me emails. I don't know how people got my email address, but they were sending those.
I think I gave it to them. Um,
Naturally.
yeah, but I'm glad to be back. I really didn't plan on coming back this quickly. And but I'm back partly because I think that there was some positive response. I think people found it informative and I don't know, some mix of reassuring and some mix of worrying, our discussion last time. And probably that's a natural response to this issue. And so there's still a lot of questions out there. And I don't know that I have answers for all of them, but I at least have an informed opinion based on what I know.
Yeah, yeah, and as we were talking just a second ago too, like there's not as many people in the community that they're as credible as like a doctor or a real someone that really practices. So I guess just kind of back up, like you're not just some schmuck. like
Oh, right.
like so like you're very well credited and you really know what you're talking about, and like that's the coolest part about having you on here is like we can
Well,
actually sit
and
back and
I
talk.
think it's a challenge. I would say that don't believe me just because I'm a doctor, right? Because there's doctors out there who probably are very smart, practice good medicine, but um, maybe don't know much about COVID-19 because they haven't done a lot of reading.
Hmm.
I would say that I've done a lot of reading because, well, I sort of find it interesting,
Hmm.
partly, and I also feel like it's my responsibility to have a better handle on this, at least what's known, and and then it's partly because of what I've been watching for 2 to 3 months evolve, and then my concerns, at least from a public health point of view, for our community. Now, if you have anybody, if I don't care if they're a doctor or the president who says they know everything about COVID 19,
Hmm.
they don't, right?
Right.
Because no one knows everything about
Yeah.
COVID
Yeah.
19. There's still uncertainty, but at least it didn't start here, right? So
Right.
we have a lot of information. It has been out for 3 months. We have a lot of information from China and South Korea and Singapore and Italy, and even within the United States and Washington State. So we have a better understanding of this disease. And that's the information that I've used to inform myself.
Yeah. Well, you're definitely well informed because, you know, like down to it seems like every statistic. I was talking to somebody actually after the previous podcast we did. I was like, this guy he had all the numbers, all like, that's got to be the hardest thing, is like the actual numbers. But one thing from the previous podcast that I really wanted to ask you, and I totally spaced it, as we got into things, is like if you get it, can you get it again, or is it like the chicken pox? Is this something that lives
Mm.
with you and then you just kind of deal with it as you go? Is it like an immunity that you build up to this? Like how does that work?
Yeah, so you know what? There's lots of different ways that virus can affect us. Chickenpox it's a virus too. It's a different virus, and it's a weird virus because you can get it when you're little, and then it lives inside your nerve endings or somewhere in your body and kind of sits there forever, and then it reactivates as shingles when you get older. Sometimes when you're younger, but yeah, it's a weird virus. Most coronaviruses, and again, this is a whole family. That's why we say COVID 19, or there's a longer name that I'm not going to go into here to specify that this is a coronavirus. Most coronaviruses, they do not live inside your body and just kind of hang out there.
Mm-hmm.
Now, I'm going to say that they don't hang out there for a long time, but I mean, people spread the virus to one another. So when you're sick with it, you will spread the virus to someone else. Or we know that there are some asymptomatic carriers. And again, those are more likely going to be younger people. And they can spread the virus without really having much symptoms of the disease. Now, they're probably less effective spreaders because we use this term shedding, or they're letting off less viral particles when you're less sick. And you're letting off most viral particles when you're having a high fever. So that just means the virus is most active. That's part of the reason we say, hey, stay home if you have a fever. And it's not just coronavirus or COVID-19. It's everything, right? So influenza, you're most contagious when you're febrile. And it doesn't mean if you make yourself afebrile or you take care of your fever by taking some Tylenol or whatever, that suddenly you're not contagious anymore. That's not a thing. You're still contagious. You've just suppressed your fever response with the medication.
Right.
So, you will, if you get COVID-19, you will get an immune response, and you will develop antibodies in your body that fight it off. And then you will likely be less susceptible to getting it again. And if you get it again, you will have likely a less severe illness. So the common cold, we give it one name because it's easy, but it's probably lots of different viruses cause the common cold. Many of them are coronaviruses or parainfluenza or rhinoviruses. These are all different families of viruses, and you can get all of them. And sometimes, how, for those of you guys who have little kids out there, when they turn about 2 and they go to daycare and then they come home and they're sick all the time, and when it's your first kid, you get sick all the time. But then it's your second kid, and your second kid is a year or 2 behind them. They bring it home too, and they get really sick. But their older brother, sister doesn't get as sick, and you don't get as sick. It's because you just experienced a lot of this with your other child a little bit ago, so you have some immunity. Now, sometimes you'll get a new one that you haven't gotten, and everybody gets sick again. But then you'll have some immunity. Now, we don't know precisely how long the immunity for COVID-19 lasts. We do think that you'll probably be most resistant to getting it again immediately after you got it. And then eventually that immunity will wane, and then you'll be more susceptible again. But you'll probably be never as susceptible again as you were the first time you got it. And
Really?
that's the concept of immune memory.
Mm-hmm.
So our body has some memory of infections that we've had in the past.
I've heard that, yeah.
Yep. So it can mount a more rapid response when it experiences the same thing again, so long as it didn't kill you the first time.
Right. So, yeah, you definitely can get it again, then, it sounds like. And
yes.
It just sounds like to me like you're not going to get it immediately. So, and I know a lot of people with, if they are concerned that they have it, talking about total isolation and kind of what that means for them, as far as like staying in their home. So if you think you have it, I guess what would you suggest for people to do? I mean, just strictly stay at home. I mean, have, a loved one come and drop off groceries in the driveway or, whatever it takes. I mean,
so if, part of it depends on what stage of the illness. We said, if you're rapidly shedding virus, febrile, coughing, you've got droplets coming out of your nose and your mouth and things like this.
Yeah.
You really need to be careful, because that's when you're most contagious to someone else. So at that time, I would say, boy, get in your room, shut the door, have someone leave the food outside your door.
Yeah.
And have them knock every once in a while, say, how are you? How you doing?
You good?
Right. And then, put your dirty dishes out there, and then let them
slide it under the door.
Let them take care of you, and then, and I think that for so long as you don't get critically ill, I don't know exactly how long that phase would last, but I'm saying somewhere between 2 to 4 to 6 to 7 days, something like that. That's sort of the worst. And then you're less contagious immediately when you contract it, right? So your body, the virus hasn't quite multiplied yet, right? In your body, and you're not able to shed that much of it. And so you're not that contagious immediately when you get it, but you have no idea that you got it because you don't feel it at all. And then you say, oh, I feel a little maybe achy, or I feel a little temperature instability, which means maybe I just don't feel quite right, like hot or cold or otherwise. And then, and probably then you're more contagious, but not as contagious as if you're having a fever. It's like a curve again, and then it gradually improves. There are other specifics to this that I don't know, but I would say that if we're going to say that there's a 14-day range of infectivity, your peak is going to be when you're febrile, or have the highest fever, which is going to be probably around day 7.
Huh. So it is a little shorter. I thought it seemed like it was... There's so much information out there, but I didn't know it was so short. 7 days, I mean, that's not...
No, I'm going to say 7 days is when you're going to reach your peak infectivity.
Oh, gotcha.
And then your contagiousness is probably going to be minimum of 14 days.
Oh, okay. Okay.
Yep. Now, there are some exceptions. CDC.gov just updated this evening or this afternoon on their website some criteria for people who have known COVID-19 or suspected COVID-19. And we're going to treat those people the same. I know we're going to talk about testing.
Yeah.
Because if you have suspected COVID-19, you should just act like you have it.
What's the difference? Like, what's...
A suspected COVID-19 means that we think you have it, but we haven't officially tested you to say that you have it.
Gotcha.
Right?
Okay. Yeah.
And I think that right now we should just treat them the same. As a doctor, I would say, well, you should isolate for 14 days if you have suspected COVID-19. And if you have known COVID-19, you should isolate for 14 days. There are criteria on cdc.gov where people may be released from quarantine earlier than 14 days. It's not a lot earlier, right? It's maybe a couple of days earlier, but it's based on repeated testing. It's based on when your fevers went away. It's based on other criteria I'm not going to go into here, but it'll be linked on our website, and it's our website fwhealth.org is going to be updated tomorrow morning, and I believe that the link that the CDC page it goes to is going to be continually updated as we learn more about the disease.
I'm gonna check this camera real quick. Oh yeah, still hold the shot. Okay. So another thing too that I guess with that is one thing that a lot of people have been worried about too is, and I don't want to kind of pin you down on any kind of conspiracy theory or anything like that, but like if any, should we be concerned about like some type of lockdown? People not allowed to leave your home, and and like the scary horror movie type of thing that everyone kind of is painting that picture out to be.
Yeah. Well, my not answering immediately probably says that there's some uncertainty there.
Right.
I would say that whether we need to be on lockdown or not probably depends on how we respond now.
Right.
Meaning, do we take reasonable restrictions? Do we listen to the guidance from our, public health, our health professionals? And I emphasize that because if we want to get good guidance on this, and with all due respect to Governor Holcomb, other political leaders that have been giving advice, we need advice from our public health leaders and from our infectious disease specialists. And I think if we follow that advice or make a good effort to follow that advice, then it's less likely that we will go on lockdown. Now, lockdown's this loaded word. But
Right,
there's a lot of
right.
different ways to think about lockdown, right? Maybe a curfew, maybe shut down domestic airline travel, which is a thought. I
Did
mean,
you see that coming?
well,
I've wondered that. Don't want to get you too sidetracked.
you know
but
what? I really don't know. But I mean, how many times in your life have they shut down all flights from Europe?
Right.
Right? Not, never, right?
Yep.
And we'll try to skip over whether that was a wise decision or not, but it's not a significant factor about whether we will have lockdown in the United States because the disease is already here. And I am going to back up a little bit. Some people may wonder, okay, well, why did Dr. Sharma pass the Fountain Warren County health guidance on March 10th and then update it on March 12th? And, why did he do this before the CDC or before the governor did? And I would say, well, because I'm a medical doctor that practices public health.
Mm-hmm.
Because I felt that that was reasonable guidance. And I would say, well, you can see that the CDC said no gathering for people over 500, and then 250, and then 50.
Yeah.
And now 10.
Is that what it is now? It's 10?
Yes. Where we were a week ago.
Yeah.
Right? And you look at where the CDC was initially on travel or the State Department of Health. We have been dragging our feet on this response, and I don't know why. I don't know why, but these restrictions have been moving towards the direction that it makes more sense. But at the same time, with how quickly the disease spreads and different factors like doubling time, I mean, a couple of days later, or 4 days or 6 days or 2 weeks later, it's too late, right?
Yeah.
We had enough information. We just didn't act appropriately. And I think it sends mixed messages to everybody out there. And it's not like I just looked in my crystal ball and said that, oh, this is going to happen. Even the State Department of Health Commissioner, Chris Box, this weekend, and I did not hear the interviews personally, but she said she suspected this weekend, which was several days ago, that we have 60,000 cases of coronavirus in the state of Indiana.
In the state?
Yes.
Wow.
And I believe that was her quote. I should check it while we're talking here. I just feel a little uncomfortable sort of saying something because...
that's an astronomical number.
Yes.
By itself. I mean, that's a lot. A lot more than I would have thought.
Yes. So I verified it, right? Because it seems astronomical, right? Because you see these statistics come out every day, and the ISDH says, oh, well, we're up to 20. Or last Friday it was no new cases today. And I'm like, well, that's fine because we've done like 120 tests at that time. And now we've done, I don't know the numbers today. But it is interesting to look and think that if our state health commissioner this weekend is saying that she suspects we have up to 60,000 cases, and if you remember,
that's a shitload of people.
That is right.
Yeah.
And we just don't know because we're not testing, and we're not testing because we don't have the tests. Now, this brings up an issue, and I know it's a question. I really think it's so important for everybody to realize that. So what? We don't have the tests. I would love it if we had more tests.
What does that mean? Like we don't have the tests. So
well, we don't have test kits.
Oh, okay.
So the test kits, it requires some viral media, and that viral media means like stuff where you can take a swab, stick it in your nose, put it in the media, which is something that will keep it alive long enough outside of the body that then you can send it somewhere else and test it and say, oh yeah, that virus is still in there.
Got it.
Because, this gets to another question everybody has. Well, how long does the virus live out of the body? We'll get to that, but we'll go back to the testing. So, no, we don't have nearly enough testing in the United States as we should. And this is not just Williamsport, Indiana, or Fountain in Warren County. I have two colleagues who I did residency with at Duke University, and one's still at Duke University. She's residency program director, where I trained, and another one is a residency program director at UT Southwestern in Houston. And we were having this, we haven't talked in months, but someone sent out a text and said, "How are you doing?" And then it was a group text, and like we were all on there like madly like exchanging information, because we're like, okay, hanging in there. And then the guy in Houston says, "Well, we've done 2,000 tests in Houston out of 6 million people." That was the statistic for Houston. I said, "Hey, we've done 120 tests in Indiana out of 6.5 million people." And, the numbers are similar in North Carolina. And I would just say that, well, it's frustrating about testing. I would not encourage people to focus on the frustration. The purpose of testing, I think testing can give people or individuals perhaps some peace of mind, right? Say, well, I'm sick. I wonder if I have COVID-19. And test, hey, you have COVID-19. So stay home and self-isolate, wash your hands, cover your nose, things like this. And then after 14 days, as long as you're feeling fine, you can go out. So that is not a different outcome than, hey, I have a cough and a fever. I wonder if I have COVID-19. Oh, we can't do a test. Hey, stay home, self-isolate, cover your nose, and well, if you want to look at the bright side, well, then you might not have the copay or the test or the cost of the test or other things, and you don't have the hassle of the testing. You just say, well, okay, I have COVID-19. I actually saw a 17-year-old guy. He's nice kid. He's got a little bit of anxiety, and he came in the other day with his mom, and had a cough, had a fever a couple of days ago, and I saw him, and I said, "Hey, maybe you have COVID-19."
No,
but
damn.
I said, but you're not that sick,
Right?
and you're not that old, so you're probably gonna be fine. But it is important that you go home and self-isolate and follow all these rules. And if you need a note for school or work, I can help you with that. And then as I walked out, he was talking to his mom. I don't know what the term is, but I think on Facebook, like whenever he says whenever someone's got some medical condition, they could put it on there so people have a prayer box for them or something like this. And he says, "Oh, Mom, I'm going to put it on there so people can have a prayer box for me." And so I walked back in and I said, I said, you can put it in really big letters. "My doctor says I have COVID-19. And then right next to it, in smaller letters, you can put "maybe."
Right. Yeah.
Right?
Yeah.
So, and that's not to make light of it. It does give people some peace of mind.
Yeah.
To have an answer.
Right.
That's part of the purpose of testing. But the bigger purpose of testing is from an epidemiological understanding of the spread of disease. That's why I want testing.
Right.
Is it in Fountain County? Is it in Warren County? How severely should we restrict things now? I'm presuming it's here, by the way. So I think these restrictions are reasonable. But I don't have any proof of it. But lack of proof doesn't mean that I'm wrong.
Right.
It probably more reflects lack of testing.
Right. Yeah. Just lack of information.
Yes.
Yeah.
And so I'm going to say, well, if Dr. Box is correct and we have 60,000 cases in Indiana out of 92 counties, it would be statistically unlikely that we would have no cases in Fountain or Warren County.
Right. Absolutely. That's very frightening. to say the least. I mean, and I know that we got into it a little bit, but it seems like as time goes on, and even in just a couple of days, does it seem like it's becoming more deadly than had previously thought? I mean, is that
Oh,
about
well,
the same?
that's an interesting question. And I would say, so we talked a few days ago, and I said, boy, we think the mortality rate for COVID-19 is about 1 to 2% for the entire population.
Right.
Okay. And I would say, based on what we know from Wuhan, China, it's 0% for less than 10. That's reassuring.
You're right.
That's reassuring. And
Less
it's
than
about
10 years old.
less than
Yeah.
10 years old.
Yeah.
Yes. And then it's about 0.2%, 0.2%. And then it goes up significantly when you're 60. And then around 70 years of age, I think it's around 14%. Now, this is all in China.
Mm-hmm.
Now, I don't want people to think, well, if it's that in China, it's going to be half that in the United States, because I almost thought that. However, the total mortality rate in Italy, where we know, I think this situation has not been handled well, and I'm not casting aspersions. I really don't know exactly how things went down there, but the total mortality rate in Italy, from what numbers I see, is around 5.4%. So that's significantly higher than 1 to 2%.
Right.
And so the mortality rate depends on how quickly the disease spreads, how quickly it overwhelms the medical community's ability to respond to it, and other factors which just depend on the socioeconomics of the country. But,
Sure, yeah.
I mean, Italy's a first world country.
Right.
So is the United States. And I don't necessarily like that term of first or second or third world, but it's just we're developed countries with lots of resources.
Right.
But South Korea and Singapore, I don't know the mortality rates there, but I know that they're on the lower side, closer to probably 1% or potentially less. And that's for the total population. And that means, well, the mortality risk for everybody decreases. Not only the people over 70, but
Right.
it's, decreases for people over 50. Because if you're 50 and you happen to be one of the unlucky, 1 in 100 who really get sick with COVID-19, then you need an ICU bed, but it's full of, 70 or 60 or 80-year-old people, and you're fifth in line. They're not going to pull that person out of that bed
Right.
and put you in there, right?
Yeah.
It's not going to happen. So what we need to do is slow the spread of the disease so our medical system can absorb it appropriately. That doesn't mean it's going to save everybody's life, but it does mean that we will be better at absorbing it, and it will cause less damage.
Yeah. So that was one of the gray areas for me. I was so confused. I was like, well, how is this gonna? Because just me, like on the outside looking in, I'm like, how is this gonna stop anything if you keep everybody at home, and and everybody has it. But I guess I didn't really take into consideration too of them fighting it off, and so it kind of bringing the disease into more of like a recession, and it kind of going away a little bit that way.
Yeah, so I mean, it's like if you are drinking through a straw, you can drink the whole glass.
Right.
Right? It just takes longer. But if you just tilt the whole glass up on top of your head,
Right.
only part of it gets in your mouth.
Yep.
Right? Most of it goes all over the place. And that part, well, the stuff that ends up all over the place is stuff that you didn't want to lose that water.
Right.
You don't want to lose those people. But
Yeah.
we're going to lose them if our medical system can't appropriately help the people who we can save.
That's a really good way to put it. Another thing too that I wanted to ask is, so like I know that it's like from the last time that we spoke, that it goes through like the droplets in your throat and that kind of thing. People had asked about, and I thought it was a really interesting thing, but the more I thought about it, I was like, damn, okay, well, maybe. Like, what about like dogs or like pets, family pets?
Yeah.
You know?
So, I think we talked about the pangolin last time, right? So I would encourage you guys to all look up the pangolin. There's some theory that maybe the pangolin was the initial animal reservoir for COVID-19 and MERS. I think that's the Middle East respiratory virus, which is also coronavirus, was from camels, and SARS might have been from bats, and and so I think that there are these animal to human transmissions that we think that that's how the virus initiates, right?
Mhm.
So that this virus initially wasn't something that affected humans, and then we think that either there was a mutation or some exposure or communication between, or not communication, some contact between humans and the initial host that doesn't happen very often, that then brings that virus into, Homo sapiens or human beings,
Mhm.
and then humans spread it amongst themselves. So, so there's this question. Well, I've heard it a couple times? Has COVID-19 been around for a long time? Well, I guess my answer is I don't really know. Was it a new mutation that caused it to be spread amongst humans rapidly? And if that was, well, then it's mutated. So then I'm just going to say if it's mutated, it's not been around a long time because it's a new mutation,
Right.
right?
Right.
And if it was maybe lying around in some animal reservoir and then it got transmitted to humans, well, possibly it's been around a long time. But I doubt that it's just been like in one province in China and sitting around there for a long time and then suddenly spread all over the world. That would just not make any
It doesn't
sense.
seem like that's
Right.
very. Yeah, I'm with you on that. And so, like, even just like, well, I mean, and I don't want to. I was just more curious about this than anything, so I don't want to keep beating a dead horse. But uh, if you like, say I have it right, and I cough on my dog,
Mm-hmm.
and then
Yeah.
take him for a walk or
So,
whatever, and you come over there, and oh, he's a good boy, and you're just roughing
oh,
him up.
okay. Well, yeah. So, I do think if you cough on your dog
Yeah,
and I come and touch your dog immediately,
yeah,
and then I rub my face in their face,
yeah,
I could get it.
yeah.
But I don't. But that would be just still the particles from you
Right, not
that
going
went
through
to
the
him,
animal.
right? And it's kind of like, well, it's not. I don't know. Maybe it is kind of like, that when people say, "Oh, I get poison ivy and it keeps spreading," right? I'm gonna bust a myth here, right?
Uh-huh.
Poison ivy really doesn't spread. It's you got the oil on your body and you develop the rash a couple days later. You get the rash first where you got the most oil,
Uh-huh.
and then it'll pop up in other places where you didn't get as much oil. But it doesn't mean that it's spreading. It's just you got exposed 2 or 3 days ago. Now, you can get poison ivy from your dog too, or your jeans that you didn't wash, or keep putting them on because the oil is still on your dog or your jeans, and
Got it.
then they could spread it to you. So I don't know if this is a good analogy, but
That's
no,
actually, yeah, that makes
yeah.
it, that makes total sense. And this is a little off topic, but another question that I personally had is, I've been hearing this a ton lately, and it's, well, this whole thing's being blown out of proportion, and it's because of social media,
Oh.
and H1N1, like a lot of people are saying, H1N1, was far more deadly than this, and this is all because of social media that this is being blown out of proportion. I mean, would you say that social media holds any truth to that? Do you think people are overreacting at all, or do you think that that there is validity in it being taken? People taking extreme precautions.
So I'm just gonna say, well, H1N1 is influenza virus.
Mm-hmm.
It's a very different beast than coronavirus.
Mm-hmm.
So the comparison to begin with is invalid,
Uh-huh.
and that undermines any argument like that. However, there are more statistics because I don't know what the uh, mortality rate of H1N1 is.
It was like the last time I checked, it was, and I did look this up a little while back. It was like 48%. Is what I saw. I can't.
Oh, yeah, that's.
Is that way
I
too
think
high?
that is horribly incorrect.
Yeah, and like I said, I can't really contest to the validity of it, but when I saw it, I thought the same thing. I was like, that seems awfully high.
So what I see, and again, the internet has all the right answers
Right.
and wrong answers too. And I would say the 2009 H1N1 pandemic, based on the CDC website, we are saying that we think that the mortality rate sorry.
No, that's all right. I kind of put you on the spot with that one.
Yeah.
I freeballed that one.
And I did see comparison of this recently, but I would just say that I think that it's lower. We had lots of people infected with H1N1.
Yeah, you would know far more about it than I would.
Yeah.
I'm just a dummy that reads stuff on the internet.
Yeah. Let me see.
But I thought the same thing because I knew a few people that had it. They had H1N1. And like I remember being in school, it seemed to be like
Yes.
they were taking a ton of precautions in the school at the time, but it didn't seem like it was anything like this.
I would say that it looks to me like the mortality rate we think is about this. It's easier in retrospect, right, to look back and see, but the mortality rate for H1N1 was 0.02%.
Yeah, so my 48% that I
Yeah.
read wherever.
So when you say, well, then that's, I don't know what, maybe 100 times less than this.
This, okay.
Depending on what country you're in.
Sure.
Right? Because then we'd say, well, it's, 500 times less if you're in Italy.
Uh-huh.
That's about right.
Yeah.
250.
So you're just saying that it's not a valid comparison.
Well, it isn't, but the mortality rate with H1N1, which was very good at getting people sick, but it just didn't kill that many people. Now, it killed people, and I'm sorry if you lost someone to H1N1, it was a bad thing, but it was never I don't know if it was ever labeled well, it probably was labeled a global pandemic. Actually, you know what? When I became health officer in April of 2009, literally 2 weeks later, the H1N1 pandemic hit.
Really?
And I was like, well,
Yeah,
I
you're
became
like,
health
really?
officer, and I'm like, oh, well, in public health, how often do we have a pandemic? And 2 weeks later,
It hits. Damn.
I just so we learned a lot from that, and I learned a lot from that, and I believe it or not, I learned how much I could depend on state support, how much I could depend on federal support, and what I took home from that is that they'll do their best. But I'm just Fountain and Warren County, Indiana, so I better get my butt in gear and get moving.
Right, yeah.
And that's what I learned, and it's been helpful, and so here we are today.
Yeah. So do you think that, kind of on the other side of that, do you think that social media is blowing this up out of proportion? Do you think people aren't taking this as serious as they should? What are your thoughts on that?
I would say I don't have my finger on the pulse of social media. So I am not aware of what's out there on Facebook or Snapchat or Instagram unless I put it out there, because I just I'll be honest, I don't use it as a news source or a source of entertainment for myself. So I am blissfully unaware of how the general public is responding to this. And I know that we did get about 6,000 views so far, at least on the one post of this podcast from last time. I know we have 25,000 people in Fountain and Warren County, so I think that's pretty good.
Yeah.
A lot of those are kids less than 10 who probably don't want to sit and watch
Right.
two old guys sit and talk all the time. And I'm older than you, but
No, you're right. Yeah, I'm with you.
and so so my feeling is, well, I think people are entitled to their own opinions. And I'll tell you that I'm giving you here my opinion, but it's a medical opinion.
Right.
And it's an informed opinion.
Mm-hmm.
And I encourage everybody that if you are taking what you read on social media or Twitter or whatever as fact, I would say you're probably gonna have problems.
Yeah, you'd be like me with that 48%.
You're right. Because I mean 48%, well, you were only off by a factor of like a crazy amount.
Right.
I mean,
yeah.
so and you see here, like I am a little preoccupied with trying to make sure that if I say something, that I'm fairly certain about it.
Right.
Especially if I say, by me, certain is near, over 99% certain. And
Right.
that's just my personality. I really hate it personally when someone says something as if they're certain, because I internalize this. I think we all do, right?
Yeah.
You think, well, if you say it like that, you must know your
Yeah.
stuff, right?
Right.
And so for me, when I was growing up, I was like, wow, boy, they seem like they really know. And then I would look it up or check it out, and I'd be like, huh.
That's not even, it's not even close.
They don't follow the same rules that I do.
Right.
Right. So I'm okay with other people having their opinion, and we all have opinion. And I can't say that I'm not giving you my opinion, but it is an informed opinion based on my duty as health officer of Fountain and Warren County. And as having, family here, as growing up here, and as caring about the community. Mm-hmm. So that's the advice that I'm giving you. And if you don't like it, I'm okay, but it doesn't make it untrue.
Right.
Or it doesn't make it an uninformed opinion.
Yeah.
Right?
Yep.
And if you got someone else, right? If you're going to talk to Dr. Fauci, and I will happily defer to Dr. Fauci from the Centers for Disease Control. I will happily defer to many other people, but unfortunately, he's not here in Fountain and Warren County, and you're stuck with me.
I like that. One thing, too, when you mentioned the public, too, is so I don't know how far you see this whole thing playing out, like in the long run of, how long this is really going to last, but people had mentioned going back to school. Like, I guess, I don't know their schedule. It says April 13th, school's back in session. Is that something that you see happening? Do you think this will play out far longer than that? Do you think they'll go back to school and still have to fight this in the long term? What are your thoughts on that?
So, I would say, and again, I'm starting off this way because it's easier for us to look and see what Indiana University has done, right? Mm-hmm. They have essentially said, well, we're not going to be back in school this year.
Did they really?
Yeah.
I didn't know that.
And I believe Purdue has done the same. And so I think initially it was, okay, well, all classes online for 2 weeks after spring break.
Mm-hmm.
And now they're just saying they're not going back in school this year. And Purdue's moving to, vacate some of the dorms that are there. And they've got all sorts of things to figure out. So I would really love it if we could get back in school, because I think it would help a lot of people feel somewhat normal.
Right.
And from a disease spread point of view, I am not certain that it is the right or the wrong answer, but from a humanity and a humanitarian point of view, I think trying to get back to school reasonably is important because it helps people feel normal. It helps with social connections. It allows parents to go to work, right? And make a living and pay the bills and, take vacations again, right? All of that stuff. So it will be, at least right now, it's up to the schools to make that decision, because I've certainly not made any decisions for the schools to say that they should or should not. I think that I likely will be in touch with the school administrators over the next 2 weeks. I am breathing a little bit of a sigh of relief that they're on spring break right now, because it just makes it easy for me.
Give you a little time.
But that doesn't mean we don't have lots of other things to be doing at the health department, which is why my days have been very long recently. And if you said, would I bet money that the schools are going to be back in a session on April 13th, I would give it a less than 10% chance.
Wow. No kidding. Okay. Yeah. So I guess with that kind of playing out, do you foresee this being an ongoing thing for, as far as a community for a while? I mean, I know, like, I went to the bank today and like talking to them, and it's the first, I made a post about this, and it's the first time being in the community that I've really felt like there's panic in the air.
Mm-hmm.
People are beginning to panic. Like, I was in Indianapolis yesterday, and going to the store, like, there's nothing in the stores.
Mm-hmm.
Like, the freezers weren't on. There was just nothing in them. There was
Yeah.
no meat. There was there's just nothing. And I feel people beginning to panic, and to me that's really alarming.
Yeah.
And I don't think people should panic. I think maybe they should be prepared within reason.
Right.
I don't know. I don't have all the answers, but one thing that is a little bit shocking about that is it seems like you see this playing out to be a longer game than maybe what some people are even prepared to fight.
So, I've thought a lot about this question. I have answers, and I have thoughts, and they are informed opinions, and I will share them with you. And I think that there's an emphasis that I want to make is that, well, we need to see how this plays out. I'm going to say definitely the next 30 days, this is the way it's going to be. And I think it's likely going to go on longer than that. However, this does not mean that I think that there's going to be empty grocery shelves and no meat in the freezers and no toilet paper and all out of Hellman's mayonnaise. Did I say that the other day?
Huh.
Right. Well, okay, so I went to the grocery store last Friday, and the Hellman's has all these mayonnaises with like canola oil and low fat, and you don't want that stuff, right? You just want the original, the real mayonnaise. And all the other shelves were full, but the real mayonnaise was gone.
You were pissed.
And most people would be like, Dr. Sharma eats mayonnaise, and I was like, yes, it's good. It really is good.
It's good.
So like the shelves that were empty were the mayonnaise and the toilet paper.
What? Where are you shopping, guy?
It was Meyer and Danville, and yes, I did cross state lines. I would say yes, but it was necessary travel, and
Right.
I encourage everybody to shop locally.
Yeah.
And I am going to say this, and I know we're off topic, and we were on this
We're so good.
very serious topic, and then I got off on a mayonnaise tangent.
Really
So,
happy about it, to be honest.
I do want to say that, and I'm going to forget this by the end of the thing, so I'm just going to insert it here.
Mm-hmm.
There are a lot of business owners. There are a lot of individuals that are hurting because they may not be able to go to work.
Yeah.
Maybe they just opened a restaurant. Maybe they need to pay their staff, their wait staff, and they're not going to be able to because they have to do curbside pickup. And how many waitresses do you need to carry a bag from up front to out the door, right? Not that many. And are people going to tip them? we need to be considering this. The FW Health website, fwhealth.org, we're having a significant upgrade on our coronavirus page. So you can go to fwhealth.org and you'll see the banner up top and it says click here to learn more, and that'll take you to this new page. I will direct you all the way down to the bottom. There is super information on there, and we will go over that at some other time. But there's information about, do I need tested? How do I get tested? All this stuff. That's great. But at the bottom, we are having a button that you can click for a GoFundMe account that we will be accepting donations, not for the Fountain and Warren County Health Department, and it is not for medical services related to COVID-19. It is dedicated to helping to lift the burden off of individuals and businesses who are going to be financially impacted through this COVID-19 response.
Wow.
And my feeling is that it's important that you know that it's out there. Hopefully it'll be up and working as of tomorrow, March 18th. And, think about it. Now, it's complicated. This was sort of done on the fly today because we're redoing our website, and I sort of floated this idea, and I had to get permission, and then, I sort of had to get permission, but it was basically me just running it by one of the board members and saying, hey, do you think I could do this? And I'm not going to be in charge.
Like a really good idea.
I'm not going to be in charge of how this money's distributed. We don't know when this money's going to be distributed, but we do know that the goal is that this money will be distributed within Fountain and Warren County to people who've had financial hardships based on the response and the impact of COVID-19, but not medical care. Unfortunately, we can't cover everything. So this is going to be for businesses that are closing, or maybe for people who canceled trips. But my feeling is that this is, for you and other people in the community who can contribute. The goal down the road is that maybe we'll have an open period where people make an application over a month. They put, what they lost, try to save some
That's awesome.
receipts or other things and prove it. And then the health department board will determine how to distribute those funds in the fairest way possible, which is not going to be an easy thing. So to keep that impact on our community the least possible, I encourage you to go to Robbie's, call them up, order something and pick it up. Call that. I know there's a new barbecue place up.
Just had it today. Real good. Psalms.
At Harrison, the country club, right?
Yeah.
And
Psalms Smokehouse.
And so support them, right? If we're restricting travel, right? I mean, is the Attica Hotel or is it the motel up there? Are they going to have people staying there?
Right.
I don't know these answers, but it's not all Attica either. I would say this is Covington, this is Vetersburg, Hershey's, right? That's great. Now I don't know if they're in season yet, but they will be.
Right.
Now they're outside, so maybe they'll still, be able to, serve food, and people will still go to Hershey's, probably the same.
Yeah.
But my feeling is, think about these things. Patronize these companies. I don't want to shut down all social interactions because, it's not healthy financially or mentally for the community. But this sort of gets back to, how long are we going to be dealing with? Say, let's take it 30 days at a time. And speaking of evidence-based discussions, that means using evidence to form your opinions. And it's not, I don't know, that I read it on some social media or Facebook post. That's not evidence. It's that you maybe read a scientific article, check its resources, think if it's valid, and then use that. Because just because it says it doesn't mean it's real. It just depends on, was it a well-done study? So
right.
There was a study today from the Imperial College in London. And specifically, do you guys want a mouthful here? So this is the impact of non-pharmaceutical interventions, NPIs, to reduce COVID-19 mortality and healthcare demand. This was published on March 16th, 2020, so just yesterday. And I had a friend who had forwarded that to me today. I did not have time to read the article. However, I asked my husband, who's a PhD biologist and physiologist, to read it, to summarize it for me, and to email it back to me because I was too busy with other things today. Seeing patients, talking with the hospital, working with the health department, talking with commissioners and councilmen. Thank you for your support. And then, fortunately, Kent sent that back to me with an analysis. And this paper is basically using what we've learned in Wuhan, China, and in South Korea to model the spread and the expected duration of the COVID-19 pandemic in the United States. And what it shows is that we expect to reach the peak of infections in approximately 3 months. And that would put us out to mid-June. And so that 3-month scenario, that sounds like a long time. And it is. But I think we should try to spend some time wrapping our head around it. Because I would say, well, it looks like that's what it's going to be based on what we know. So now, if it comes June and somehow we've reached our peak on April 1st, I welcome everybody to look around and say, boy, Dr. Sharma was way off with this, right? Fine. I am fine with being wrong, and I will be happy to be back to normal. But right now, I would say, based on the evidence, based on statistical modeling of what's gone on with COVID-19 so far, our peak is going to be around mid-June. And that peak, if we're effective at slowing the spread, flattening the curve, I prefer slow the spread, it just makes more sense. If we're effective, well, it pushes that peak out. It pushes it out further, but it also lowers that peak, right? So it doesn't overwhelm our medical system. But that is what, and I know I use the words prevention and mitigation, and I'm going to go back and probably edit that a little bit. So there is prevention, which is mean we just keep it out of our community. And although we have no confirmed cases in Fountain and Warren County, I expect that the cases are here. So technically, we are probably somewhere between prevention and mitigation. And then there's this third category, which is unmitigated, which is even more frightening than mitigated. Right?
Yeah.
So we don't want to allow things to be unmitigated. I would say that with an unmitigated response, this statistical model also shows what the expected penetration is in the United States. That means how many people get infected, and that's I think our total population is around 370 million, something like that. And so they suggest about 80% of the United States will be infected, and that suspects the predicted mortality with this from this paper is that there will be about 2.2 million deaths in an unmitigated scenario. I know that's a frightening number. The mitigated scenario is approximately 1 million, and the completely prevented scenario, it seems like, well, that's just not possible right now unless you happen to live in Antarctica and plan on staying there forever.
Yeah.
Right.
And kind of going off that too, a lot of things that I've been hearing about, in particular Italy,
Yeah.
What exactly is going on in Italy? I haven't had really much of a chance to catch up on that and try to find. I know it's kind of a broad question, but
People use this word, and I've never thought about it before, but Italy is an unmitigated disaster, right? And it's just, that's appropriate use of that word. I just gave you three categories: prevention, mitigated, and unmitigated. And I've heard that term long before I was in public health. And well, Italy is an unmitigated disaster. Their mortality rates over 5% for COVID-19, as opposed to what we think it should be, probably closer to 1 to 2%, because they did not respond appropriately. And they did not listen to reasonable guidance, restrict some travel. I'm not saying they didn't wash their hands. I don't know, but it's just they didn't do lots of things. And I don't know that we know precisely which one of these steps makes the biggest difference, right? Is the biggest difference to, take people over 60 and tell them to stay home? Is it washing your hands? Is it restricting travel? Is it closing schools? Is it, all of these things?
Right.
We're just saying, do them all right now. We'll probably have a better idea in a little bit. Can we loosen up on this? Can we let students back in school? And then maybe still try to protect some of the older people by treating them a little bit differently, but then letting the rest of the world get back to normal. We will be able to make a more informed decision later. What we need to do is, give us some time to play out.
Yeah. Okay. So with that, man, there's so many questions up here that I've got that I just don't want to leave anybody out either. So I know that testing seemed to be a real hot thing. Is there anything in particular that you want to hit on that? Because I know some people had questions about it. Like, are there any available tests for our community and, available yet?
So I kind of hit on this earlier, but I'm going to emphasize it again. Testing is not treatment. I don't think it makes much difference to you and your COVID experience, except for maybe giving you some sense of closure about whether you get tested for COVID-19 or not. So my feeling is, probably find a way to process that, because currently the health department has been requesting tests from multiple sources, including the State Department of Health and private labs, at least two, that are available to us. And we have a commitment for 5 possible five tests that we can have with an undetermined ship date.
Wow.
So now that's a little frustrating for me, because I've put a lot of effort into defining this testing protocol and algorithm and triage and everything else. It's been a lot of effort. Tough. It's been a lot of effort over the last few days. But then deciding who we test is really challenging, because I would say, I have no tests. And so I know some people are going to get frustrated. You're entitled to your frustration. I can't fix it. I do think that more testing will become available. When I hear, and I heard it this morning, there are millions of tests in the United States. If they are, they're not here, and it's not for lack of trying.
Right.
I've spoken with my elected representative. I've spoken with the State Department of Health. Literally, last 4 days ago, like Saturday, the day after our first podcast, I was, Friday, Saturday, Sunday, I was at the health department pretty much all day. And I probably sent out, I would say, 400 emails.
Wow.
And I created lots of documents and other things like this, but it was mad effort on my part. And I think that, perhaps I'm leaving some stone unturned. But when I talked to, I mentioned earlier, when I talked to my friend in Houston, when I talked to my friend in Durham at Duke University and at UT Southwestern, it's the same thing.
For them as well.
Yeah, I mean, they probably have a little bit more tests. Now, it's a little bit different because they're practicing clinical medicine, which I do too. So if someone's in the hospital, it's slightly easier for me to get them tested. But clearly, if you're in the hospital, you're a little sicker.
Right.
And so it doesn't mean that we're testing everybody that comes in the hospital.
Uh-huh.
But, if you have a fever and a cough and we're concerned, we are testing because it makes a difference in terms of how we isolate you.
Yeah.
It makes a difference in terms of, boy, do we have to worry about, this nurse was exposed, and so then she can't work for 14 days.
Right.
And so that information helps us to know how we can continue to practice medicine safely. So whether you like it or not, that's a better way to use a limited resource than just giving you some peace of mind to say, well, I have my test and it's in process.
Yeah.
Now, I don't have insight into this, although my friends, again, at Duke University and UT Southwestern have shared with me that they've been told that they will get tests with a quicker turnaround time sometime in about a week. And that's a turnaround time of about 4 to 8 hours. And so those 5 tests that I told you that I was promised, the turnaround time for those is 5 days. So even if I get those 10 days from now, but then somehow I get a batch of tests that have a turnaround time for 4 hours, well, I'm never going to use the 5-day test because that's just not very useful.
Yeah.
So this is just changing a lot. We have 0 tests at the Fountain Warren County Health Department. That does not mean that you should not potentially still use our website and click on the button says, do I need tested? And then there will be this document that you should read first that sort of walks you through and helps you to make that decision of, do you need tested? Because it's very specifically laid out. And if you think that this document is something that came out easily, it is not. This is something that I have worked on for days, and God bless Kelly Thornburg, and I hope she appreciates this shout out, because she has edited this document probably 50 times, and at least 15 times after it was final. So it's like comes out as a final document, and then I send it back and I said, oh, we need to make this other change. And this isn't me who came up with this document alone. I would say, well, Pam Miller, nurse at Ascension Williamsport, Trina Marlatt, administrator at Williamsport, Peter Byers, who's ER doctor. He lives, I think, in Colorado, and Dr. Edgerly Gibbs, who's an ER doctor. I don't know where she lives, but somewhere else. They all helped with editing this document. So I would create it, I would send it out, and then they would give me their comments back in emails, and then I would put those in, try to coordinate them, and then send it out, comment, put it back in. This is a lot of work because we need to make sure that you understand it when you read it. And then, I send it out to my sister at the end, right? So, she's not in medicine, right?
How easy is this to follow?
What does she understand? I send it out to, I'm going to give another shout out to Mindy Hunter. She's, smart girl, Warren County, not a native, but she might as well be. And she was helpful, got me information back. My husband, Kent, got me information back. They all did that. And I would send it out by email, and I'd text him and I said, review this email quickly, right?
Yeah.
Get it back to me, because it's like constant. And then I'm, working on other documents, and I don't care what you think about whether I'm overreacting or whether our health department is overreacting, but certainly this is not the way I wanted to spend my weekend. And I would say, you know what, I am going to talk about this because it's important. I'm in the midst of a job transition. Today was my last day practicing primary care medicine at the North Clinic, and this is not really how I wanted it to happen, right? There was a party, small party for me that my nurse, Tina Million, who is she is a gem of Warren County. She made all these beautiful cookies for me, and everybody else was back there, not more than 10,
Yeah.
in the room, like eating, and I was in my office editing a document and a script so I could record it for the website that's hopefully going to be up tomorrow, because it had to get done, or I felt like it had to get done. And I said, give me 5 minutes. So then I took probably 10, and then I went and I had a couple cookies before I recorded the recording so that I could sound more relaxed.
Yeah, you're sitting back there kind of, yeah.
So, but no, you know what? I don't know what we're talking about now, but
Getting loaded up on cookies.
I was, well, cookies are one of my weaknesses. Like, you're getting it all right. Hellman's Real Mayonnaise cookies, they gotta be good cookies.
Yeah.
Right? Like, you just,
I'm not into those sugar cookies with that
Yeah.
thick frosting stuff. No.
yeah. So good cookies, and then Doritos.
Oh,
So
like
and
the blue bag.
you
the
know
Cool
what?
Ranch?
I'm probably equal opportunity Dorito guy.
Oh,
but-
yeah?
yeah. But
You
I
get that green
do
one,
like
the salsa verde.
no. Let's say mainly the Cool Ranch and the original.
Oh,
right?
yeah.
But so here people are like, oh well, Dr. Sharma doesn't eat these things. You know what? I do, and I'm gonna tell you this. These are the rules, and this is so off COVID-19, but whatever. Maybe it'll entertain people.
Yeah.
So these are our rules about buying Doritos, and they're my rules. That if we're going on vacation, we can buy Doritos, and it's got to be a real vacation. It can't be like we're just going overnight somewhere. That's not a real vacation. It's got to be a whole week.
Oh, okay.
Then we can buy Doritos, but it has to be like the Friday that we go grocery shopping before we go on vacation. If I go down that chip aisle and the Doritos aren't on sale, I can't buy any.
Oh,
And so I can't buy any. And if they're on sale, but they're on one
those
of
things
those,
are always on sale, though.
well, they usually are, but sometimes, not always, but sometimes they're like 29 cents off. And I'm like,
You're like, I'll take it.
no.
Oh, no.
I say that's not a real sale. We can't.
Oh, you got the harsh sale law.
We
in effect.
can't do that. So my nurse Tina, who made the cookies today, and she bought 2 bags of Doritos, and I don't know what I was having. I was eating cookies, and I smelled the Doritos. I didn't even see them. I smelled them.
From across the room. Was they that far away?
I said, well, it went in my head, and I'm like, oh, someone got Doritos. And there were 2 bags of Doritos over there, and so I got some out, and I said, oh wow, that's so great, because these are my favorite chips. And Tina's sitting over there like, I know they're your favorite.
Yeah, that's why I got them.
Right. And then I go and I'm like telling Trina came out and had lunch today for the whatever 15 minutes we were sitting there, and I said I was telling her about all these rules about buying Doritos, and then Tina's sitting over there because I've shared these rules with her before, and she goes, Dr. Sharma, these were buy one get one free.
Oh, does that count?
Yeah.
Oh,
yeah,
because that's a sale.
That's a good deal.
Yeah,
right? And so I was like, it made the Doritos taste even better. So that's how I function, right? And so whether
Doritos and cookies and mayonnaise, I love it.
Those are my motivations. It is not my motivation to sit around thinking about, do I need COVID testing, or pestering county officials to fund public health emergency response.
Yeah, I guess we've really nailed about everything on this. Well, I say we kind of loosely because it ain't been me, but so the one thing that looks like is less is who would you consider to be vulnerable after the elderly?
Yeah, so that's a good question. I'm gonna say I think the logical answer is probably the immunocompromised people, and that means people whose immune systems, which should fight off disease, are weaker. Mm-hmm. Now, I'm a little curious about that because I don't know that I have evidence to say for certain that that's the case, but we do know that people with coronary artery disease and COPD and otherwise maybe at risk. So it is okay. So I'm going to say either it's the immunocompromised. I don't have evidence for that, but I'm going to say it's probably people who are more physiologically challenged with functional systems, organ systems like your heart or your lungs. And I'm going to go with them, but I'm going to explain this first. Your immune system is important to fight off disease. That's very true. Although part of the reason that COVID-19 impacts you so badly is because I think that part of it is because of your immune response, which can be really robust and maybe can sometimes overreact and then cause lots of inflammation and destruction of lung tissue, which and it can fill it up with fluid, and then you can't breathe, and that's how you die. So I'm sort of curious if people with weaker immune systems, not that they're going to be safe from this, but that because then the virus will replicate and your body won't be able to fight it off as much, but maybe they won't have as robust of an immune response. And I'd be curious if you're more at risk if your immune system is weak, or if it's because your heart can't handle it and your lungs can't handle it. So, most people with those heart disease, lung disease, say kidney disease, liver disease, they're going to be older too. Mm-hmm. But I think that's there are, if you happen to have lung disease, like maybe bad asthma or cystic fibrosis or something else in your lung and you're younger, that's probably potentially concerning to me. But then the immunocompromised, and that means maybe you're post bone marrow transplant, or you're post organ transplant and you're on immunosuppressants, or you're on chronic prednisone for rheumatoid arthritis, or we consider diabetes somewhat immune compromised, right? Mm-hmm. And it just means your body doesn't mount an immune response as well as it should. So,
yeah, it's interesting. I guess, is there anything else that maybe I've missed or anything like that that's not on that list that you want to hit on or talk about? I mean, I feel like we've covered a lot.
Yeah.
And the only thing that I really have on that list there that looks like maybe we kind of, I mean, we still hit on it a little bit, but even like the mutation, so like the two strains of that. I mean,
you know what? I had two staff in the health department. We were having a staff meeting, probably nearly 2 hours after the office closed today again, and someone brought up this there, and I would say, well, I don't know, and I don't know how much I care. Mm-hmm. Right. And I think that the challenge is if someone's going to prove that the strain has mutated, well, I probably really care if it gets more deadly.
Right.
But, mutations are typically very random. And if something mutates, well, then is it likely that it's going to be worse than COVID-19 as it is, which is pretty bad, and, the only global pandemic of my lifetime? It seems unlikely. Right. Yeah. Now, if it somehow mutates, and it seems like a snowball chance that it's going to mutate, that it gets a lot worse. This is me just using logic. I am not a virologist. Yeah. I do not know, say, how frequently things are mutating with, say, COVID-19, but my feeling is that, well, I doubt that we're going to have a COVID-20. Right? Because it was just called COVID-19 because it was, I think, first identified on like December 31st, 2019. Yeah. It was almost COVID-20.
Right.
But not quite there. So do I think we're suddenly going to have a COVID-20? Well, we haven't had a COVID-18 or 17, and I doubt that that's going to be a thing. So whether it's mutated or not, does it really matter to me or otherwise? Mutation, I think, is a scary word, which is why I think people see it and they're like, well, I don't want to get mutated. Well, it has nothing to do with that. It just, and probably things somewhat mutate frequently, and who cares unless it's more deadly, and the statistical chance of that is quite small. So probably stop talking about mutation unless like you know that you're going in there and genetically modifying this disease to be a weapon.
Right.
Right. Well, then that brings up this whole other thing. I don't think, well, I am going to say, I don't know. I'm sure there's conspiracy theories out there to say, boy, is this some bioterrorist thing? Is this something that got out of a lab somewhere? I've heard nothing of the sort, and I don't think that that's a thing. And even if it is, well, what can we do about it?
Right. It still doesn't change where we're at.
So I'm not spending my nights worrying about that. I'm worrying about mayonnaise.
Yeah. Yeah, mayonnaise, of course. Yeah, I had people ask about that, and it's like, I don't know. But, I mean, even spending time on that, it's tough because, like, you can't, like, what are you going to say? How are you going to prove it?
Yeah.
And it still doesn't change
Right.
anything. You're still here.
So there is, I think, this sort of complicated question. I had this guy, I'll just say Greg, I'll give him a shout out, because he wrote an email to the health department yesterday, and I normally wouldn't respond to emails individually, but I did, because I thought his question was interesting and thoughtful. So he said, well, I'm this age and I have a weak immune system because I have diabetes and this, and I would, he has probably hypertension, heart disease, and obesity, and all of those things aren't good, right? And he said, and I'm over 60, so I consider myself at high risk, but I have 2 4-year-old grandchildren that I want to see, right?
Mm-hmm. Oh, I got that email. Yeah.
Yeah.
Okay.
It's like, can I see them? And how would I do that? And what do you recommend? And so, I think that that's challenging. So my feeling is that, well, we know that kids are wonderful at spreading germs, and in this situation with COVID-19, they're probably even better because they can have it and not be symptomatic, but still spread it, and that's really challenging. So then, well, how do you effectively keep kids away from adults, or people over 60? Because my boys love to sit on Omi's lap and read books or, whatever, snuggle up, and all of that's great, but that's not social distancing. So, my advice to him was, actually, we were going to do this with our children today, not me, because I haven't been home in a long time, it feels like. But we have 3 boys, and they were going to go out with my sister and niece and their dad today and practice social distancing.
Oh,
yeah, they were going to do that, and well, I don't know how that was going to happen, but I mean, I guess you just say, well, let's not hold hands, let's not bump into one another, and that's and you know what, I'm fine if my boys still wrestle and push each other down. Yeah. That's fine, because, well, they're all in the same house anyway, so if one of them gets it, all of them gets it.
Right.
But then, and so maybe, I'm not saying you need to do this all the time, but little kids are amazing at being aware and being able to answer or adapt, right? And so I think that if you say that this is a concern, then they'll listen, they'll remember, right? And they'll and you might have to remind them right before you go in with grandma and grandpa, or right before you go in wherever, and say, oh, remember, we're not doing this.
Yeah.
And you can still feel a connection with people without touching them. Right. So, yeah. I mean, we're a distant ways apart right here, but we've got all this stuff in between us, but I feel like we're having a good conversation, right?
Yeah, absolutely.
And so honestly, I think I've met you twice now, and we've elbow bumped, and that's about it, but I feel like I know you pretty well, right?
Yeah, absolutely.
So my feeling is that, well, let's just challenge ourselves to think about how we do it. Now, So should this guy welcome his kids into his house and have them run around and touch everything? And well, probably the answer is likely not. I don't think that that's smart. Now, if those kids have, and I'm not saying that this is what everybody wants to do, but if those kids are on spring break for 2 weeks and they've just been staying home and not going out unnecessarily to the grocery store or other things, then and they're not sick, then sure, it's really unlikely that they still have coronavirus and are shedding it after being, essentially away from humanity for 2 weeks, and then you can go love on each other.
Right.
But my feeling is that, well, how often do we socially isolate our kids for 2 weeks in a row? Most people don't. Although my boys are on about day 9 right now because they're going to Omi and Gigi's this weekend.
Oh yeah, I remember you mentioned that. Yeah.
And so then that's the goal. So long as they're all healthy, then we're in the clear.
Right.
Right.
Yeah.
So I think that's that question. How do you effectively isolate when you want to be close with people? And so if you have those 4-year-olds over and you want to love on them, my recommendations for loving on them is probably if they've been very isolated for 14 days. Otherwise, find another way to do it. Kick shoes, bump elbows, or you know what, if you got a high five, then high five and sanitize right afterwards. If you want to go out for a walk with those kids, take them on a hike. It's healthy. It's not like coronavirus is just floating around in the air all over the place.
Right.
We don't think that that's the case. We should get to that too.
Yeah, actually, that's an interesting.
Right. So I would say, go out for a walk. But then I'm not saying necessarily to go to the park and sit on the bench where everybody else is sat and touch the handles. Like if you did that, and sounds so germophobic, and I'm not really a germaphobe, but if you must sit down on the bench, well, take some wipes with you, wipe it down. When we're cleaning something medically, it's typically not just wiping it down and it's magically clean. It's wiping it down, and then usually we try to let it dry. Then you say, okay, well, then it's done, right?
Yeah.
And so and I would say that realize if those kids have been in isolation, you go to the park and then they go jump on that jungle gym that 20 other kids have been that day. Could they pick up the coronavirus on there? It's possible. We don't think that this virus lives forever on inanimate, meaning non-living objects. We think it's somewhere between 2 and 3 days. Someone called into the health department the other day and they said, boy, someone sent me money in the mail for a payment and I don't want to touch it because it's got coronavirus. How do I disinfect my money? And well, that sounds complicated to disinfect your money, but it sounds really easy to just say, well, why don't you put that envelope to the side and reopen it 5 days later?
Right.
Right? That's easy.
Yeah.
Right? And so so I think there's some other ways to think about it, and that's one thing that I would do. This guy had also said, should I wear gloves? Say I have all these issues and I'm concerned about getting out, but I don't have anybody who can go to the grocery store for me. Can I go to the grocery store? And should I wear gloves? And he said, you've specifically told us not to wear a mask. I agree with that. Don't wear a mask unless you're a healthcare worker. Responding to a situation where there's a high likelihood that you could get exposed, then those healthcare workers should wear the N95 masks or respirators. And then there are probably some other situations where you can wear a mask. So if you're sick and going into a healthcare facility, it'd be great if you had a mask on before you got in there. But if you don't, try to cover your mouth with something and go up to the window and say, I'm sick with a cough and a fever. Can I have a mask? And they'll have them right there, right where you check in, because they want you to identify yourself immediately. And
Just curious, right quick too. Why would you say no mask when you're out and about?
well, so you know what? When regular people have a mask on, that means non-medical people, and probably medical people do this too. Well, the mask feels uncomfortable, so they're up there fidgeting with their face all the time, and then they end up touching their eyes, and they haven't washed their hands, and then they're more likely to contaminate themselves just because they put this stupid mask on in the first place.
Okay,
right? So
makes total sense.
now a mask can provide some protection, but it's probably going to cause more problems than benefits. And if you're practicing appropriate social distancing and not crowding, your need to wear a mask is probably nil. If you're just doing your routine stuff, say in the grocery store or whatever. Now, if you get up right next to the person in front of you and say, what's taking you so long at this self-checkout line, right?
Hi.
Then you shouldn't do that, right?
Right.
Back off. Look at your phone. Don't just give them the eye, and then just wait until they're on their merry way. But this guy did ask, should I wear gloves? And I was like, well, I am not opposed to him wearing gloves because we know his hands are going to be all over the place. They're going to be touching lots of stuff and the cart. And I went to Meijer the other day. I love Meijer, right? And I love our local county market too. And I think and the food basket, and I think there's one in Petersburg too.
It's like the food something.
Yeah,
food store.
Patronize those because Meijer didn't have milk or mayonnaise the other day, so I'm going to be going to the food basket or county market to get those things.
Yeah,
hopefully. And so he said, should I wear gloves? But when I went to Meijer, they didn't have those little sanitizer things, and I was like, well, I have to have a card,
right?
So I got one, and I'm just like, well, I'm gonna try to remember not to touch my face and to wash my hands, and I probably didn't do a very good job of it because we're just not very good at it. So that guy, should he wear gloves? Sure, it's reasonable. It will provide some protection, but you can't take your gloved hand and then scratch your nose or pick your ear, whatever, right? Because you will do that. You'll probably realize once you got it up to your mouth and you say, "Oh, I have a glove on," right?
Yeah.
Right. But and the other thing I would say is gloves. We recommend that once you take those gloves off, you should still wash your hands. It's not like magically they're clean in underneath there. Like, what if there was a hole in the glove that you didn't know about? Mm-hmm. What if it doesn't make your hands clean just because you had a glove on? So I would say wash your hands after you de-glove, which is a word. And do that. So how long does the virus last in the air? I would say, well, it probably it would be similar to inanimate surfaces, right? Mm-hmm. It's not gonna somehow live around in the air longer than it is on, say, your couch or something like this,
right?
And so it just would live longer on people, but that doesn't. I'm gonna say inside people where it can replicate. Right?
Yeah,
'cause that's how they live, is they make more of themselves, and so I think those are helpful things to know.
Yeah, is it true that it lives? I heard from what I would consider a rather reputable source, but that it can live in the back of your throat for like 4 days. Is that true? Like,
well, so I would not be surprised about that because I don't know that we know enough to say that, these people are carriers of coronavirus. We use that term for, sometimes. So someone who gets sore throats all the time, right? They come in, we do this little strep test and we test it and then look at it and say, oh, well, you're positive for strep.
Yeah.
And they're like, well, I just had strep last week. And I've had strep 10 times this year. And they say, I need my tonsils out. And they're like, well, maybe they're just a carrier, right?
Uh-huh.
Because you can carry group A strep is the specific type of strep because there's lots of types of strep again.
Uh-huh.
and you can carry it, but then it doesn't mean it's what's always causing your sore throat. It's probably rhinovirus or adenovirus or RSV that's causing your sore throat. And everybody's going to know all these viral names because there's lots of viruses out there.
Mm-hmm.
And just because you test positive for strep, we're testing what you happen to carry around with you, but we shouldn't necessarily treat your sore throat every time with an antibiotic, because most likely it's not strep every time. You just happen to test positive for it, and that takes clinical judgment. That's why they haven't come up with a computer doctor yet, right? Because it is really complicated, right? You gotta take the history, you gotta look at the person, you gotta do the exam, and then you've gotta maybe do some tests, and you've gotta interpret them, and then you've gotta make sure that. And if you don't believe the test results, well, then you do it again, or figure out, do you think there's something wrong with it? So my feeling is that's true about the COVID-19 test too, right? What if you got inevitably there are going to be errors with that test, and well, you know what, at least if you never get tested, you didn't get a testing error,
Right. Yeah.
So but I don't know, it is complicated. My feeling is, yes. Do I think that there are coronavirus carriers out there? Probably. I think the bigger question is, how much do those coronavirus carriers shed? Right? So how contagious are they? Right. And well, I just, we said earlier in the first hour of this that we think you're most contagious when you have the most viral particles circulating, and that's when you're febrile and at the peak of your illness. So carriers are probably not much of spreaders. It doesn't mean they can't spread it.
Sure, makes sense.
But it just means that it's probably how the virus perpetuates, because now that it's here, I don't think coronavirus is ever going. I don't think COVID-19 is ever going away.
Right. It
just means that we get it. It gets through the community, the world. People get some immunity to it. Maybe the next time they get it, it's not that bad. Even your 80-year-old, right? First time, if she lives, right? The next time she gets it, well, it's probably not going to be that bad, right? And so that's appropriate mitigation as opposed to unmitigated. And that's, again, spreading out this curve so that the amount of people getting sick and severely sick with it doesn't overwhelm our system. Before I will get stuck on something else, but I do want to talk about airplane cancellations and hotel cancellation and trip cancellations things like this.
Yeah, my Louisiana trip got canceled.
Okay.
Yeah.
Good. I'm glad for you and the community, by the way. So my mom would appreciate this, because she says I love this statement. She says that he's so stingy he could get Abe Lincoln off a penny, right? And I just think that it's colorful, right? I know she didn't come up with it. I've heard it other places, but they appreciate that about me, and that's part of the reason why I only buy Doritos if they're on a real sale. Right?
Yeah, not that 30-cent shit.
Right. So 29 cents, because they make the 9 looks bigger and they make you.
Right.
So anyway, okay, let's have some common sense about how you cancel your trips, because this can make a difference. And I am not going to be the health board, and it is not my goal to make this GoFundMe site repay everybody for their canceled trips. Use your brains when you're doing it. Yeah. Right?
Yep.
So airlines are allowing a lot of trips to be canceled within March without fees. Well, that's great. So if you hurry up and you say, well, I'm just canceling my April trip, they'll probably charge you fees.
Right.
Just hold your horses. Be patient a little bit. Like maybe Dr. Sharma is wrong. Maybe this Imperial College of London paper that I just cited is wrong, right?
Right.
And this is all just going to disapparate. I think that's a Harry Potter word, isn't it? Yeah. And it's just going to go away. And And then you say, oh, well, I lost all that money from canceling that trip. Or you say, okay, I'm going to cancel my car rental because fortunately they don't charge you fees so long as you haven't paid ahead, because you wanted to save the, 2% that you save by paying ahead, which I do sometimes, but
that.
sometimes not. Right?
Yeah.
It's risky.
It's
Right?
very, yeah.
So maybe you cancel your car. Maybe you cancel your hotel because they're usually pretty understanding.
Yep.
And you say, okay, I'm going to wait and I'm going to see about that flight. And my feeling is definitely wait, because they're not going to allow everybody to cancel forever without any fees.
Right.
They got to put some limits on it. And then, when this all started happening a week ago, they were like, oh, well, you can cancel new bookings for this week. Well, that doesn't make sense. And they got taken to task over it. They said, well, you just can't make it for new bookings, right? What if I booked this flight 3 months ago, but it happens to be this week?
Right.
You're not letting me cancel without fees. So, and complain or be persistent. If you can and you have the gumption to, say, my public health department, Dr. Sharma, said he advises against traveling. You have the document. It's going to be on our website. You print it off. You fax it to them. It's not bluff and bluster. This is honesty, right?
Right.
Say, I'm following the advice of my doctor not to travel.
Yeah.
I did not anticipate this. The airlines didn't anticipate this either. I have less sympathy for the airline industry than I do for,
the community.
than small businesses. But I would say that, well, it's not easy for them, although the federal government's talking about bailing them out, but they're not going to bail out Robbie's or the barbecue place or Crossroads or other things like this. That's not going to happen.
Yep.
So my feeling is that, well, they can probably absorb it. And if you got someone who works in the airline industry, then I'm sorry if I'm offending you, but I would just say, well, it's logical to me, right?
Right.
They can absorb it better than you can. Plan your cancellation when the timing's right, that you can incur the least amount of cost. And I think don't do anything rashly. Pay attention. Log in. Call them. I wouldn't call in. I would probably go to the website if you have internet access. And if you don't, go to the library and ask a librarian to help you, right? Say, hey, I'm wondering if I can cancel this fee. Or download the airline app, because they all have their app now, and they probably will update it on there every day and say, now we're allowing cancellations for this with no charge. And they'll say, oh, well, you can push them on this too. They'll say, well, we'll allow you to change your flight, right? And so you say, well, I want to go to Minnesota in December now, right? Well, that doesn't sound like fun, but I would say, well, you can say, well, I don't know when this is going to stop. Right. That's not a fair thing either, right? So give them a little pushback, be persistent about it, but be nice. I mean, these people are doing their jobs too, and they have protocols that they have to follow, but it's all about being reasonable. So think about your cancellations. Don't just go off and cancel everything, but I would say anticipate that it will be canceled. I will say Portina, my nurse again, has been planning a trip to Italy for literally like a year, for her and her husband to go to Italy. And I mean, I would say over the last month, I would come in and I'd be like, well, it's not looking so good, but we can just wait and see. Yeah. So I don't know whether she's canceled her flights yet, because they're in May and it's on, this other airline, and then and it's complicated because, when you book everything separately, then it's a hassle, and then you're frustrated and everything else like this. So strike while the iron's hot and cancel when appropriate. But be smart about it, because I think there's a right way to do it and a wrong way to do it. So,
yeah. Well, I think we've covered a lot. I really do.
Okay, so I am gonna give guidance.
Yeah, that was where I wanted to go next. Kind of final final thoughts?
Yeah.
What do you like guidance? Where are you
Everybody
at?
in the community, I would say, well, it doesn't look like we're going to have testing in the next couple of weeks, although you can request it through the health department. And we have the process up in place where you will be put in one of three categories: high priority, low priority, or no testing. And if you're no testing, it doesn't mean you're not sick. It doesn't mean that 2 days later you would be in a different priority class, right? So,
Yeah.
I mean, you're welcome to call back, but right now we have no tests anyway. So,
Right.
and so then, are you going to spend the time calling? And you're welcome to call. I'm going to direct everybody to our website, fwhealth.org. Big banner up the top. It said coronavirus or COVID-19, learn more. Click it. It'll take you to this page. There's going to be a video there that's me declaring this public health emergency. There's going to be an audio file there because I did not have time to create a nice looking video. And that public health emergency, that was spur of the moment.
Is that the same video you sent me? Yeah.
I don't know. But it was spur of the moment. Literally, I set my phone up on the boardroom table in the hospital after I saw patients that morning and just recorded it and sent it off. And we declared a public health emergency because it facilitates resources and funding for our response. Right?
Yeah.
There's nothing that happened on Monday morning. Yeah,
Right.
It looks a little different. And so, I mean, I was spending lots of effort over Saturday and Sunday and thinking like, well, no one's doing anything. And then suddenly Monday, everybody kind of like freaks out. But it's best to announce things on Monday because people pay more attention. That's why they do big news dumps on Friday, because people just want to check out and go to their weekend.
Right.
But of course, Monday was when a lot of guidance came down from Ascension, so then they have those big banners in front of the hospital, and they have barricades, so they have one entrance, and it's scary looking, and I get it, and we all did this in the same day, but whatever, that it just all happened to happen on the same day. So on that website, you'll see that public health emergency declaration. I think it was important, and I did it. I would say that is the same reason I did the travel advisory a week ago and the travel advisory 2 days before that. And that's what I'm going to continue to do as this situation moves forward. And I am going to say that, and I know I mentioned this last time, and I know some people really don't care about this, but I would say that I am going to say thank you for my family. And that's in particular Kent, and less so, but still my sister, for the support that they've given me through this, because I would say that it's hard to make decisions and say things that other people aren't saying. And that's why on news and the outlets that you've seen, it is these public health officials that are unfortunately standing behind our elected officials and not correcting misinformation. They are not leading the charge, and I think that is inappropriate. And that's just where we're at in this country, and I don't know why. It doesn't make sense to me, but I don't function like that. I will defer to an expert who knows something more about car mechanics, or you and your microphones and podcasts. But I'm not going to defer to politicians regarding health advice.
Yeah, good point.
So, okay, go to our website. There's the public health declaration. There's an audio file that we recorded today, just a couple hours ago, during when I was missing my lunch, and then it hopefully guides you through the website. There may be some tweaks on that website. I think it's I know Tyler, and I think it's Tyler Taylor. He's in Danville.
I know him. Yeah.
A Webco.
Yep.
Boy, he's been amazing, right? He's been so much help for our department. And I know, right, if he not only this, but and he shouldn't have done this, and we're gonna pay him anyways. But we gave him so many edits today, and he said, you know what, we're not going to charge the health department anything today.
Yeah, that's really cool. Tyler's a good guy. I like him.
And now he's probably changed his mind, because I think Kelly's still at the health department saying, well, this isn't quite right.
Yeah.
And that's what I was doing right before I got here, saying, what's that button there for? We don't need that. We don't need that. And so it's complicated. Tyler is a genius at web design. He doesn't know public health, but he doesn't need to know public health, right?
Right.
I just need to say how we want it, and I think it's gonna be good. So go watch those videos. The audio file that's there, it's just a link that you click on, and it'll sort of hopefully guide you through that. If you want email updates, we're not going to give them out all the time. You can put your email in there in that box up top, and click submit, and then it'll send you a link in your email that you got to validate that you're a real person, and then you'll be involved in our email distribution. And then there are links on, do I need tested? There's a link that says just more information about COVID-19. It's got lots of information that goes directly to the CDC. And then to the right, it says sick, but not sick enough to be tested. And then you can click there and just find out what to do. Because a lot of people are going to make that decision on their own.
Right.
And you don't have to go through my 1 through 5 step tree to, see all the time we spent on that document and say, well, it's 2 pages. That doesn't look very complicated. But if you do, so if you say, boy, think you need tested, and you click on that button, and then it'll run you through that 5-step process. And there's like, maybe not 20. There's like 10 lines at the top, and it says the common sense things. If you have an uncontrolled fever and you're having severe shortness of breath, stop and call 911.
Yeah.
Or call the emergency room, or go to the emergency room. And then it says, if you're calling 911 or going to the emergency room and you have a cough and fever, let them know before you get there.
Yeah.
So you can have a mask on so you don't contaminate and shut down the whole emergency room and shut down the hospital, by the way. So it just takes one person. Right. So, and then there's further, caveats, but they're all there because they have to be. So read it carefully, and then it goes step 1. And then if you get partway down step 1 and it says, go on to step 2, or go read this guidance and stay home, right? Mm-hmm. And then it goes to step 2, and then it walks you through. If you get to step 2, then it says, get medical advice. And that medical advice is going to come from the health department. Now, it's not, well, how much ibuprofen should I take? It's not, how much Tylenol, or, do I need chicken broth or pea soup, right? It's basically supportive care, over-the-counter medications, monitor your symptoms. There are going to be people who on day 1, I have a little sore throat, I think I need tested, and they're going to go all the way through and send us something. And then once you get out of that document, it'll say, request testing through the health department through this website. And you can do it. You just go back out of that document. You go back to the website. Right under that, do you think you need tested? And it said, request testing. And it'll be a button. You click it. And then it'll be this fillable form, and it's got like 5 questions. Well, maybe 8 questions. Started with 5, but that's part of the process. So it's got name, your email, your contact number. There's ways to get around this. If you don't have an email, you should call us, but we would love you to do it through our website because it's going to be better. And then it says, have you had a fever over 100.5? Yes or no? Have you had a cough? Yes or no? How many days have you been sick? What's your address? And then it populates all that, and then it says submit, and then it sends it to us. Someone did, and someone did it independent of that today. I won't give them a shout out because that's not nice, but they did it perfectly. They followed the protocol perfectly, and they sent it to us. And then we look at that, and you will get an email back within 48 hours. And then it'll either move you into high priority for testing, low priority for testing, or no testing recommended. Now, it is possible that you call us on, or you work through that and you send us an email for request for testing, and we say no testing recommended. And then suddenly, you develop high fevers and cough, and then you would move up to either low priority or high priority, depending on your age, which is a big factor too.
Oh yeah.
And so then, but it's still, it's frustrating to people because they'll say, well, now I'm really sick. Now I really need testing. Well, depending on how old you are, you may not need testing. And by the way, we have 0 tests, and you all know that. It's going to be the truth for at least until next Monday. And I'm not optimistic it's going to change by next Monday. And so if you keep hearing on the news that there are millions of tests and they're all shipped, they're not here. And I've said that. I've tried to get them, and they're not here. So don't get upset with me because I've done everything that I can to get them here.
Right.
And I'm going to go again. Who cares if there's testing, except for probably some information in terms of medical isolation, some information in terms of epidemiology, and some information in terms of your peace of mind.
Yeah, testing isn't going to get you fixed.
Right. So, whatever. I feel like I keep repeating myself, but that's the stuff on the website. There's guidance there for businesses. There's guidance there for food. There's guidance there for childcare. We don't have guidance for school on there because fortunately they're out. We didn't have to generate it right away. And there's guidance there for funeral homes. There's guidance there for coroners. There's guidance on what to do when you're stuck in Warren County or Fountain County for 2 weeks, which, by the way, is not the worst place to be. I think it's a wonderful place, and it's my home, and there's lots of wonderful things to do that, by definition, meet the criteria for social isolation. Whenever we go to a lot of the niches properties, so I think that's niches.com.
Yeah.
And it's a conservation organization that has many properties where you can go hike and walk around for free.
Yeah, I just had Justin Harmison on here. And yeah, he's with them, and great folks.
Is great organization. And so whenever we go out to Portland Arch, we drive up, we park, and we're like, oh, it's really crowded today because there's one car there, right?
Right. Yeah. It must be the same car all the time because there's always one car. Who is this guy?
So no, I would say, follow the rules. Don't trash it up, right? I mean, if you take your lunch, you pack it in, you pack it out. But there's, Warren County's beautiful. If you want to just go walk on a gravel road somewhere, right? Go look for rocks along the creek. I don't know, right? My kids can enjoy dirt anywhere, right?
Right. Yeah,
So there's that guidance for what to do in this area, and then there's guidance ideally on supporting your neighbors and how do we reach out. I did have a good question the other day from sweet Carrie Austin, and I'll give her a shout out because I don't think there should be any confidentiality. She said, well, I wanted to make some bread for my neighbor.
Here we go.
Take it over to her, and I wanted to bring her some food because I've got several elderly neighbors, and I'm just like, well, she lives south of Mayberry, Warren County, but so she said, how can I do that safely? And I said, so, these are good questions, right? Do you go in and sort of take it in and then spend a lot of time and chit chat, which they're probably going to want to do?
Right.
I would say that, well, you can do that if you've been very cautious and socially isolating and or social distancing and washing your hands, not touching your face and other things. You could probably go in there and hang out and have a cup of coffee. But if you're if you're not, then I would say that then you should say, okay, well, Marge, I'm going to come over and I'm going to talk to you a little bit, but we're going to stay 6 feet apart. We're going to talk through the door. Luckily, it's getting warmer, right?
Yeah, yeah.
And then I'm going to leave this food out here. It's, you reheat it when it gets in there, and it's going to sit out here. I don't know, probably a couple hours. That's fine. You come in, you come get it and take it back in. Or, that all seems ridiculous, right? You could probably just hand it to her. But if you really wanted to be careful, right? In Italy, I know that they're putting stuff outside the door, waiting for a certain period of time, bringing it in, disinfecting it, and then throwing all that, the covering away, and then, unpacking their groceries.
No kidding.
But Italy's like in an unmitigated disaster.
Yeah.
There we're at again, right? So my feeling is, well, be like Carrie, right? Take stuff to your neighbor. I'm not saying take your kids over there, right? I would say take stuff, prepare it appropriately, right? Package it, and then deliver it, and then make sure that we're reaching out to our elderly population. One of the challenges is that, our elderly population is getting, I think people are going to get tired of hearing from me, but these are thoughts that I've had. Our elderly population is having limited access to really up-to-date information, except for what's on the news. And they're probably all saying, well, Dr. Sharma has 1 million tests over there at the Fountain Warren County Health Department, which is not the case. I doubt that your audience is comprised of too many people over age 70, right?
It tapers off at about 63 to 65-ish.
So, put the headphones on your grandpa, your grandma, and hook them up to here and let them listen, right? It's like the radio of old, right? They'll enjoy it. They'll find it interesting. They'll say, I like mayonnaise too, Dr. Dr. Sharma.
Them damn Doritos ain't on sale.
Because when we reach out to that population with the health department, we put something in the paper. We just missed the cutoff for, I think, the Fountain County Neighbor today for next week. So now either we have to pay lots of money to put a slicker in, which we're not going to, or we just have to wait another week. Right. And so what's in there is old by the time that happens. This is changing drastically. So now that they'll probably look at my travel advisory and say, oh, well, Dr. Sharma is just saying what the CDC said. But the CDC said it yesterday. The Fountain Warren County Health Department said it a week ago. Right? Yeah. And so my feeling is educate them, inform them. A lot of them are definitely aware that this is going on. But I would say, well, they're probably the most important people to inform. And we don't need to just shut them up and, throw away the key. I would say, stay in contact with them. I talked with a police officer today from Petersburg. And I talked with a police officer today from Covington. One of the things that concerns me is how well we are going to be able to handle this as a society 2 weeks, 4 weeks out. And I don't know what that answer is. But I challenge everybody who listens to this to remember your humanity. Remember what we have here, right? Be grateful for what you have, because even if this gets hard, right, we've got a great place to live, right? And this is going to get hard, but it's not, it's not, I don't know, it's not taking... Well, I don't know. In some situations, it may take your life, but it's not taking everything that you have. Right. So remember what you have, and especially the prevention issues that we're talking about. Well, it's not taking your life, right?
Absolutely,
it's an inconvenience. But coronavirus, it can unfortunately kill some people. It will kill some people. you know what? I'm going to touch base on this because most people have probably shut it off by now, but I would say that people are probably like, well, we've only had 2 deaths in Indiana, right? And, 25 cases. I didn't look at the numbers today because I had other priorities. And because the numbers are less useful because we're hardly testing anybody.
Mm-hmm.
So what do the numbers mean? And I think I said this earlier, that Dr. Box said that there were 60,000 Hoosiers with COVID-19, and she said that 4 days ago. So, well, that number is inevitably higher now.
Right.
And now they're saying that we have 2 COVID-19 deaths in Indiana. Well, I don't know. I'm not saying that we have proportionally that many deaths in Indiana, because there's complicated epidemiology there, because the deaths are later in the disease.
Right.
So I would say, well, there are deaths in Indiana that aren't being reported, that are because of COVID-19 that just never got tested.
Right.
Right.
So I mean, there would have to be.
Right. So and that's still going to be the case. So you can look at the numbers, and I like numbers a lot. But my feeling is that, well, they're really only useful if you're doing lots of testing, which we're not here. We're not in Houston, and we're not in Durham. So I don't know if we're doing it somewhere else, but it's not that I'm aware of. So I don't know. I think that's probably. Oh, I was on the talk of remembering your humanity, and it does frighten me a little bit to say, well, how are we going to respond? Are we going to be respectful of one another?
Right.
Are we going to be willing to give up a little bit of our comforts or our freedoms for the well-being of the community as a whole? And I think that it's too soon to tell about that. Right.
Interesting. That's that's one thing I worry about too.
Yep.
Is that,
and so please respect law enforcement. I don't think that they are experiencing the stress yet, but my feeling is probably a month out they probably will. So, kudos to all your efforts, and good luck to you, and good luck to the community. And I will give another caveat again to say, well, if this gets out there, I am on the record and forever as, sort of creating this whole pandemic, and now it's on 3 podcasts, and people are going to be like, boy, look at that quack, right? If none of this happens. But I would just say, well, I'm trying to use science and knowledge and evidence to get the word out and increase awareness so that we can all mitigate the situation we're in the best that we can. And I think that you're mature enough, and no matter how old you are, right, you're mature enough to process this and respond appropriately. And that's why I'm sharing this information.
Yeah. Well, it's great. I appreciate I will gladly do another one. I know this thing changes, drastically. It seems like very, very quickly.
Right. Well, so the first time it was like 53 minutes. Now it's like 2 hours.
Yeah.
And next time, if it's 3 hours, I'm just gonna to say no. But if we cut out all the mayonnaise and Doritos stuff, then
that's the best part. That's my favorite part there. But no, it really is a pleasure having you come on, and it's good getting somebody that is so knowledgeable and has all the facts, real facts. Not something that you really have to question. And so for that, I definitely thank you for coming on. Also, I would like to thank the sponsors too before we wrap this up. Grady Funeral Homes, thank you guys so much. Mike Grady's is a huge supporter of the B Team podcast, and I can't thank you enough. Harrison Hills, holla. I just went to Sam's. I know you guys aren't exactly the same, but Damn, that place is great, and I'll be back. In fact, if you guys are still serving food tonight, I'll be calling in an order as soon as we get down here. But Harrison Hills though, and Psalms, man, you guys have done a lot for me, and I really appreciate it. Midwest Roof Restoration. As the seasons change, this guy's getting packed up with business. But if your roof is getting tarnished from the cold weather, they have this chemical that they spray on it, and the guy showed me a couple of samples, and I was sold immediately, and I was like, all right, I can get behind that, and so they've been very good. If you're interested in that, you can shoot me a message, and I would like to get him. He's a local guy here in town. I'd like to get him some help and some business as much as I can. And lastly is Logan Leaf CBD. If you are curious about CBD, I'm a huge supporter of CBD oils. I don't know what you think about that, but
I'm just gonna no comment. It's a long answer, and
yeah,
I need to get home.
Yeah, that's fair enough. I love it though, and it has helped me out tremendously. And if you do have any questions, shoot me a message. You can go to loganleaf.com, and there's a variety of things that you can choose from, to suit whatever needs you have. But thank you guys so much for watching, and it's been a real pleasure to see this whole thing really take off. And thank you again for coming on.
Great. Thank you.
Yep. And I'll talk to y'all real soon.